including through our partner, AVAT, provide the means for countries to reach the global target of 70% by mid-2022. We must now turn our attention to addressing the crucial question of how we turn vaccines into vaccinations, or how we get vaccines from ports to arms. Protecting the highest priority groups, including all health workers, older adults, and those with underlying medical conditions, must remain our urgent and immediate focus to prevent severe disease, save lives, and safeguard essential health services. WHO and our ACT Accelerator partners are working day and night to address the bottlenecks that remain in partnership with countries, AVAT, the Africa CDC, funders, manufacturers, and civil society. We are on the ground with you to do whatever it takes to reach country goals, not only on vaccines, but for testing and treatment. We have also taken steps to facilitate voluntary sharing of technology, intellectual property, know-how, and data, including the COVID-19 Technology Access Pool, or CTAP, and the mRNA Technology Transfer Hub we established recently in South Africa, which has already developed its own mRNA vaccine candidate. Just last week, we announced the first 6 African countries that will receive technology from the hub to produce their own vaccines, including Nigeria. WHO has now identified 20 countries that have expressed interest in mRNA vaccine development training by South African hub. Later today, we will also be announcing the establishment of a global biomanufacturing training hub. This second hub will provide countries working with the mRNA vaccine technology hub with a broader workforce training to turn novel technologies into large-scale manufactured doses of vaccine and other products. Of course, this whole process would be accelerated if manufacturers were willing to share their intellectual property and know-how with the hub. We strongly support the proposal from South Africa and India for a temporary waiver of intellectual property rights under the TRIPS agreement for the duration of the pandemic. The flexibilities in the TRIPS agreement are there to be used in emergencies. If not now, then when? We need to pull out all the stops to achieve the 70% vaccine coverage target by the middle of this year, as well as the minimum targets for testing, treatments, and PPE coverage. Achieving the 70% target in all countries is essential for ending the pandemic as a global health emergency and driving a truly inclusive global recovery. It will also help prevent the emergence of new variants, which could be more severe or transmissible next time around. High-level political leadership and accountability in elevating COVID-19 vaccination as a national and subnational priority is an essential condition for success. To support these actions, WHO, UNICEF, and Gavi have initiated the COVID-19 Vaccine Delivery Partnership to assist government-led vaccine strategies through political engagement, delivery funding, technical assistance, and surge support. This partnership will bring the tools, training, and expertise to strengthen cold chains and logistics, deploy vaccinators, mobilize funding, strengthen data systems, engage communities, and plan and coordinate operations. Thank you all for your commitment. Actions speak louder than words. So let's get to work to get vaccines from ports to arms and end COVID-19 as a global health emergency. Again, thank you so much, my dear sister Yodi, for bringing us all together, for your hard work, commitment, and leadership. And I thank you and glad to join, even if it's virtually. Back to you.
My brother, Thank you so much for being here. Thank you for your leadership in this once-in-a-100-year moment. We're in a historical moment in time. This pandemic is going to shape our lives going forward. It's going to shape our children's and our grandchildren's futures, just as the 1940